This is how we do our diagnosis and treatment planning. We use 3D imaging, which is the state-of-the-art pictures. We can look at the positions of the teeth, the bone around the teeth, so that we know that we can move the teeth in the proper position. We can see here where the upper arch, the position of the teeth are, and I do variable prescription orthodontics, which means various root positions require different brackets to help them move to an ideal position. I don't use the same bracket for everybody. And for instance, this patient would use a bracket that was capable of moving this root forward and not tipping it forward. That's good for stability.
Dr. Kendrick, I have a question for you. Before you had this cool technology, what did you used to do? What did orthodontists used to do?
Well, orthodontists use two-dimensional films, which obviously put a three-dimensional object on a flat sheet, and it would not allow us to visualize root positions. It would not allow us to look at the temporomandibular joint, and which we can do here. Just click on it, and we can see the temporomandibular joint, make sure that it's functioning properly. No changes in the joint that we need to be made aware of before we ever put the braces on.
I see. Very interesting. So it actually allows you to be much more precise?
Exactly. We can see not only the teeth, but we can see the whole skull. We can see if there's a sinus problem. We check the airway to make sure that there's the proper airway for breathing. All these are affected by braces, and if you don't see them, you can't really diagnose the problem correctly.
I would imagine, Dr. Kendrick, that it also is very beneficial to explaining what you do to your patients before the work is actually done.
Definitely. Essentially what we do is we take the images, we go over the images in a consultation after I've had an opportunity to review them, and we can tell people this is what we're going to do for you, and just not see numbers.
That makes a lot of sense.
Picture.
Well, Dr. Kendrick, thank you so much for your time.
You're welcome.